So the importance of a medication review really depends on the individual person and where you are at the moment, but also where you've been in the past. Because accepting the status quo, so not changing anything in medication, particularly if it's a combination of medication that's maybe been quite hard won and it's taken a while to get there and it's got you well, then it's much easier not to want to change anything, which is also absolutely fine. But sometimes looking back really carefully over what medication you've had in the past, so how well it's worked for you, what the side effects were, how you feel about taking it in the long term, and perhaps what the risks and benefits might be of doing so, is really important and can be quite empowering, I think, to think about what you want to get out of your medication in the future. And it can certainly be the case that medication that served you for a particular purpose in the past may be something that you don't necessarily need now. And so we can think about stopping things or perhaps changing to something else or starting something new. And stopping something, especially if everything's been quite stable and you're doing really well, can feel quite scary. But if that is something that you want to do, then it can be really helpful, I think, to have a medication review to really think through, why was that medication started? What was it doing for me at the time? Is it going to help me going forward into the future? So that's really the purpose, I think, of having a really individualised and holistic medication review approach. And I think the advantage of doing it with a pharmacist is not only because I'm an expert in the drugs themselves and in how they're used and the evidence base around using them both acutely, so perhaps in a crisis situation, but also more in the long term. So how do they work in what you might call maintenance dosing? But also, I don't have any value judgments on why things were started or who started them. I'm not the person that prescribed them, so I can give a really balanced and external, if you like, view based on the evidence base that we know about, but also tailored to an individual person.